kind of want to get right to it because we've heard a lot. The Democrats are and have been fighting for extensions of the Affordable Health Care Act. For an international audience, kind of break it down a little bit more for us. This net for the people in the U.S. that need it the most. What role is health insurance playing in this budget battle?
Yeah, in the United States, we use an insurance model to make sure people have access to health care. More than half of the people in our country get their insurance through their job. But for a lot of people, they can't get that insurance through their job. And so when the Affordable Care Act, all called Obamacare, was passed, they created these things called health exchanges in order to provide health insurance to people who could not get it through their job primarily. And during COVID, the cost of care was so high that they added some additional government dollars to bring the cost down. And those exchanges, those additional dollars are set to expire at the end of this year. So those people who are buying health insurance through the exchange will have marked increases in their insurance, which they probably can't afford, and therefore will go without health insurance. But what's important is everybody in the systems costs are going to go up. It's not just those small group of people, because this is a national insurance model. Everybody will pay more.
Okay, what's the current reality for ACA users? Because you talked about the skyrocketing premiums, and from what I've read, it's minimum in the 20% range. And if it does have this ripple effect, it is going to undo what the government did through so much hard work more than a decade ago, trying to make sure that everybody was under this umbrella.
Well, the problem is that we already have about 26 million people in our country who are totally uninsured. We have a large number of people who are what we call underinsured. And, when you add these people to that equation, you could have 17, 18 million people who, at the end of the day, don't have health insurance at all, which means they either delay care, don't get care, or they're going to become bankrupt. The leading cause of bankruptcy in the United States is healthcare costs. So we'll have more bankruptcies.
That's just horrifying to think about that. We know that Senate lawmakers reached some kind of agreement on this deal, that the upper house is going to hold a vote. Now, a lot of Democrats are not happy with their colleagues who did, for lack of a better term, cave in to the Republican demands. But put that in perspective, because Republican House Speaker Mike Johnson has kind of indicated that he may never bring this to the floor, dooming the measure.
That's correct. The problem is those folks caved without really getting anything that they weren't going to get anyway. And the reason that the Democrats were holding out was because of trying to reduce healthcare costs, frankly, for the exchanges, but at the end of the day, for all Americans. And so what may happen is, they'll pass this bill. They'll have a vote in the Senate. Even if they pass it, the question is whether or not they will pass anything in the House.
Okay, let's look at some other nations, such as Canada, UK, Germany. Their health coverage isn't necessarily tied to employment. Talk about that, and what kind of advantage and perhaps even disadvantage do those models show when contrasted to what plays out in the United States?
Well, there's much more control of the government in those systems. They're single-payer systems. But the United States has a single-payer system for seniors called Medicare. You pay for it through your job, and then when you retire, you're eligible for Medicare. So the solution, of course, in the United States is to expand Medicare for everyone. Medicare has its flaws too, but we can fix those. Most of the fixes are pretty simple, and that's what we ought to do. And then the other thing we need to do is have a global budget so we can control healthcare costs. Single-payer system, Medicare for all, global budget to bring down healthcare costs will make us look a lot more like the other nations in the world. But by the way, we're the only industrialized nation in the world, the only high-income country that has not yet figured out how to cover all of its citizens.
Yeah, I worked at a hospital when I was in college, and I remember sending IVs to various floors that cost $2 to make, and then you see the charge, it's $200. So, these long-term policy questions do kind of play into this, and the crisis that is there about the stability, the fairness of the U.S. healthcare system.
The U.S. healthcare system is the most complicated system on the planet. And by the way, prices aren't transparent. Look, the patient is not the customer. The customer is the employer. It's the person actually paying the bulk of the healthcare costs, and our prices aren't transparent. You know, you go to buy get some drugs, a prescription for antibiotics, they could be $50. You may only pay $5 for it, but somebody pays the rest of that cost,
Mm.
and it's not you.